A left ventricular assist device, often shortened to Lvad, is a mechanical pump implanted to the left side of the heart, which aids in pumping blood throughout the body. A patient who is living with end-stage heart failure, in which other treatment methods have failed, would be considered for such a device. Typically, Lvads are used to help heart failure patients who are waiting for a transplant, or they can be used for long-term therapy, often referred to as destination therapy. In destination therapy, a particular patient is not a candidate for transplant at the time of their evaluation, but placing the Lvad will provide them with a better quality of life. When looking at the Lvad system, most of the medical device is implanted on the inside of the body. Visible on the outside of the body is a percutaneous driveline. The driveline connects the pump to the system controller. The system controller is located on the outside of the body and controls the pump. The patient usually carries this in a pocket on a vest, a neck strap, or belt attachment. You will need the following equipment for basic assessment of an Lvad patient: blood pressure cuff, Doppler ultrasound and ultrasound gel, stethoscope. To begin your assessment, recognize that the pump will be operating continuously, so the patient will not have a pulse. Also, be aware that all Lvad patients are anticoagulated due to the risk of clot formation in the pump. When assessing the patient's vital signs, be sure to check for the following. Auscultate for a hum over the patient's chest. The presence of a hum ensures the pump is running. Lvad patients will not have a blood pressure. Instead of a blood pressure measurement, it's necessary to utilize a Doppler to obtain a mean arterial pressure. You should be listening for a pulsating sound from the Doppler. The goal for the map is 70 to 90. Skin color should be pink, warm, and dry. Assess patient's orientation status to person, place, time, and situation. The patient's capillary refill should be less than 2 seconds. Check for signs of fluid overload. If the patient is fluid overloaded, you may notice swelling in the lower extremities. Following your patient's physical assessment, check the charge level of the Lvad's batteries to ensure the batteries in use are not depleted. Press the button with the battery symbol to view the approximate charge level of that battery. If the current batteries are depleted, attach fully charged replacement batteries. Spare batteries can be found in the patient's travel bag. The last step is assessment of the percutaneous driveline. Check that it is not damaged and is free of infection. While interacting with the driveline, make sure that you do not pull on or move the driveline at the exit site, severely bend, kink, or twist the driveline. Position the system controller such that it will catch on the driveline. Be careful to ensure the dressing remains intact and the driveline cable is connected to the system controller.